Hi, I'm Susan Cunningham, speech and language therapist, and I work as part of the Community Learning Disability team in NHS Lanarkshire. I would like to talk briefly about communication and possible difficulties that people who have Down syndrome might have and how we can support this. Communication, in its broadest sense, is the giving and receiving of a message in a variety of ways, such as using speech, writing, using non-verbal communication such as gesture or signs, facial expression, body language and tone of voice, using objects, pictures and photographs, and using our behaviour. Most people will use a mixture of all of these when communicating. Communication, whether we are giving a message or receiving a message, is a large part of what it means to be a human being. And we need to be able to communicate effectively with those around us in order to get the things we need or want, to make comments and give opinions, to follow instructions, to make choices, to ask and answer questions, to express our feelings, and most importantly, to build and maintain relationships. People with Down syndrome have the same communication needs as all people and can be skilled communicators. However, for some people with Down syndrome, there can be difficulties with some or all aspects of communication, and if this is not recognised and supported, then this can impact negatively on their quality of life. Some of the types of difficulties that someone with Down syndrome might experience when communicating can include a difficulty in being able to focus on another person's message, a difficulty understanding lengthy or complex sentences, a difficulty understanding the words that are being used, a difficulty remembering information, a difficulty in being able to use language to express complex thoughts, feelings and ideas, a difficulty using clear speech sounds, a difficulty in understanding some of the subtleties of social interactions. Other difficulties that are common in people with Down syndrome are hearing impairment and visual impairment, which could have a significant effect on communication if not identified and addressed. So what is the impact of having a communication difficulty for a person with Down syndrome? The impact of any difficulty with communication can be frustration and anxiety and can result in reduced confidence and self-esteem, in turn leading to increased social isolation. That's why it is so important to recognise any communication difficulties so that we can develop strategies to support communication effectively and minimise any barriers to successful and pleasurable interactions. There are things that we can all do to improve the communication experiences of people with Down syndrome. Here are some communication tips. Do get to know the person and how they communicate. Make sure you have the person's attention when speaking to them. Make sure the person has their hearing aids in, switched on and working, and glasses on if appropriate. Consider the environment. Is it noisy and distracting? Use short sentences and common everyday words. Add gesture, tone of voice and facial expression to your message. Get to know the person and how they communicate. For example, do they use specific gestures or signs that hold meaning for them? People with Down syndrome respond well to visual information, so we should recognise this strength and make use of it when communicating. Use pictures, photographs and objects to add meaning to your message. Use photographs, pictures or objects to help someone get their message across. Go at their pace. Give the person plenty of time to listen and respond to what you are saying. Check that the person has understood your message and be consistent when communicating. Some don'ts. Don't assume that someone understands everything. Some people with Down syndrome can appear skilled at talking to others but still have difficulty understanding everything that they hear. Don't have more than one person speaking at once. Don't overload someone with lots of verbal information and instructions at the one time. Don't use figurative language, but instead be clear about what it is you are saying. If we are able to use these strategies and adapt the way we communicate to support someone with Down syndrome to better understand and express themselves, then we will be creating more positive communication experiences for people. This can help to ensure that people with Down syndrome feel valued as communication partners regardless of their communication support needs. People with Down syndrome are individuals with individual skills and needs, and if you have any concerns around communication and would like advice on how to support someone's communication, then contact your local speech and language therapy department for further information.